Let's go over a quick and easy rehab exercise known as sciatic nerve gliding or sciatic nerve flossing. And what you're going to be doing with this exercise is gently flossing, almost like you're flossing your teeth, but we're going to be flossing that sciatic nerve back and forth to free up any spots that it's irritated or gunked up, causing sciatica. Now, the way that this exercise works is basically your sciatic nerve is formed by nerves from your spinal cord, and it's formed around the low back here, which then travels down the back of the thigh. Where it reaches the back of the knee, it splits up into a few different nerves, which then continue down to the foot. So when we're going to be extending our leg like this, we're going to be tensioning that nerve down. And at the same time as we're extending our leg, we're going to be tilting our head back. And what that's going to do is actually take tension off the spinal cord, allowing it to drop. And again, we're tensioning that nerve down, so everything's going to be moving down. And then we're going to be coming back by bending our knee, and that's going to take the tension off that sciatic nerve. At the same time, we're going to be bringing our chin down to our chest. That's going to be pulling or tensioning the spinal cord up, so everything's going to be coming back up. So another thing that's important to mention, and we're going to go over the exercise here in a second, but it's important to mention that you shouldn't experience any pain or worsening of your symptoms when you do this exercise. If you do experience any of those two things, stop doing the exercise and let your practitioner know next time you see them. So we're going to go over two different ways that you can do this depending on your comfort level. We're going to start with the beginner version and then talk about a more advanced version afterwards. So for the beginner version, what we're going to do is we're going to start off seated like this, and we're going to take the leg with the sciatica, so say it's my right leg. And again, what you're going to be doing is slowly extending that knee while tipping your head back, and that whole motion should take about 3 seconds to do. And then once we reach the end, we're going to come back by bending the knee and bringing the chin down to the chest. And again, that should take about 3 seconds to do. So I'm going to go ahead and demonstrate that right now. So again, just slowly, nice and controlled, tilt that head back, straighten that knee. Once you reach the end, come back down by bending the knee and bringing the chin down to the chest. Now, if you feel like that is uncomfortable or too painful to do, what you can try is doing that again, but with a slightly more reclined position like this. And this is going to take a little bit of that tension off that nerve. So if you were to try like this, and you find that this is more relieving and there's no pain, do it this way. So that's one repetition of the exercise, one extension and one flexion. Now let's talk about the more advanced version of the exercise. So with the more advanced version, we're actually going to be adding a little bit of ankle motion to further pull or tension that nerve down and then further relax it or slack it, allowing it to come back up. So it's going to look exactly the same, but as we reach the end of the knee extension, we're actually going to be tipping our toes up to further pull that nerve down. And then when we're coming back down by bending our knee, we're going to be tipping our toes downwards. So it's going to look something like this. So slowly extend that knee, tilt that head back, bring those toes up to the sky for an extra pull of that nerve, and then come back down and tip those toes down. And again, that's one repetition of the exercise right there. Now, another thing to mention when you're doing this exercise, you never want to be looking down at your toes like this, because what you would be doing in that case would be pulling the nerve down and pulling the spinal cord up, and that could definitely be pretty irritating. So try to synchronize tilting the head back and extending the knee, and then bringing the foot down and bringing the chin down to the chest. Now to start, you can do 8 repetitions of this exercise for 2 sets, and you can do that 1 to 3 times a day. And if you feel like you can tolerate more, you can move up to doing 10 repetitions of the exercise for 3 sets and do that up to 3 times a day.